implications of the pandemic. And then we take a look at where we are with research, testing, trials as new variants emerge and of course remain dominant in the country. So I'd like to now welcome our guests. We've got Honourable Minister Mamoloko Kubane-Ngubane, the South African Minister of Tourism, and she'll be giving us insights into the emergence of the new coronavirus variants, as well as the impact on tourism and trade. Joining us, we have Dr. Richard Mihigo, Coordinator, Immunization and Vaccines Development Program at the WHO. We have apologies from Dr. Moeti, who couldn't join us today due to an emergency. Dr. Song, the Director of the Africa Centers for Disease Control and Prevention, to highlight the Africa trends and data on various countries, as well as the AU interventions. And we'll also be joined by Dr. Mboneni Moafe, the Deputy Director General, DDG, for Technology Innovation at the Department of Science and Innovation. And he'll be highlighting the scientific evidence of viruses undergoing mutations and giving rise to new variants. And of course, we do have the latest information that the variant that is now dominant in South Africa could actually neutralize other variants and other lineages that have emerged around the world. So this is a moving target. There's so much information that's coming through on a day-to-day basis. So our aim today is to try and shed light on some of these issues and, of course, the implications it has on economic activity, specifically tourism in South Africa. But first, I'd like to hand over now to Michael Curran, the Acting Deputy Director General, ICSM at GCIS, and he'll be delivering welcoming remarks and highlighting the importance of working together as stakeholders. Mr. Curran, over to you, sir.
Thank you, Eleni Gyokos from CNN, our moderator today. It's very lovely to see you and have you with us. You've welcomed our guests. I'm not going to take time on that, but really greetings to all of you and our esteemed panel from the very far northeast of the country right down to the south. I see my minister has a Table Mountain behind her there, so we are fully continental. And Moafe, I hope, is going to share with us something hot off the press because we were preparing for that today. So, Doc and Addis, lovely to see you again, and really thank you for being here. Friends, you know, today, I would also just to say our Director General, Ms. Pumla Williams, who probably all know well, will join us later in the session. But as we all know well, the issue of misperceptions, misinformation, misnoming, has had huge consequences that have aggravated the issue of socioeconomic impact of this pandemic. You know, the name SA variant led certain policy choices in certain countries which have had huge impact, and I'm sure Minister might touch on it. The manner in which the pandemic has impacted the lives of ordinary people all over the world and our continent has shown that we honestly need a very quick, open, dynamic flow of information and collaboration to actually ensure that information management doesn't become one of the problems that exacerbates the actual impact and scope of the pandemic. And friends, as GCIS, that's what our vision and mission is about. We have put a number, with partners, of course, I might say, we've put a number of communication platforms and interventions in place from early last year to actually ensure that there's strong and open debate and discussion around the developments in this whole tragedy, I think we can say. Many millions of folks around the world have lost their lives. And it's our considered view that frank, if necessary, frank and tough discussion needs to happen between all parties in a spirit of giving information that equips us to make effective decision-making. One of the things, Program Director, that I've noticed, you know, when you do public communication, looking at the public mood, the country, media mood, very often last year we were in hot water. And, you know, the president kept referring to building the plane as we fly. And I had COVID over December, January, and my physician was saying, this is a once in a century medical virus that we actually don't know how it's panning out, changes, it mutates. And what does that mean? It means that sometimes we can think people are not sharing information, but in actual fact, we don't know where the seat goes in the plane at that point in time. And then we misunderstand that as an intention to withhold information. So I think the purpose of the webinar today, as I welcome all of you and the many viewers involved, is really just to have an open discussion, to see how the changes that we're going through, the mutation of the virus, the changes in various socioeconomic factors as this is unfolded, the issue of access to vaccination is being handled in the best interests of the population of the world and in Africa and its people specifically. So I really commend to the meeting a very open discussion, a very frank discussion. If there are issues that need elaboration further, we would be very willing as government communication to take it further. But from my side, Eleni, I just need to really humbly thank this very esteemed panel of guests for being so willing to cooperate with us and collaborate in sharing the news and giving your perspective on things. So I do hope that it's a very robust discussion, a fruitful one, and one that we can actually leave with perhaps some scope as to how we can tighten communication opportunities moving forward. So thank you very much, Program Director, Madam Minister, and the other esteemed doctors in the panel. From my side as GSAS, very welcome and sincere thanks.
Thank you very much, DDG, for those opening remarks and, of course, setting the scene for us and allowing us the space to be frank and to ensure that we get the right messages out there. I'm going to now allow each panelist the time to set the scene before we get into our robust discussion. You all have around 6 minutes max. I humbly request that you keep to the allotted time so we can try and get through as much as possible in the Q&A session. Honourable Minister, I'd like to now hand over to you, ma'am.
Thank you very much, Ms. Elaine Chiokas, CNN correspondent. I think, let me acknowledge Dr. Mboneni Mwofe from the Department of Science and Innovation, Dr. John Nkeng-Asong, the Director of Africa Center for Disease Control and Prevention, Ms. Pumla Williams, the Director General of GCIS, Mr. Michael Karen, the Acting DDG for GCIS. Good afternoon, ladies and gentlemen. When the COVID-19, actually the pandemic first broke out and started spreading to all the corners of the world, we all erroneously believed that there was going to be a single wave that will reach a peak and afterwards the spread would be contained. Armed with this belief, most countries around the world constructed economic recovery models that were linked to the scenario of a single wave. In South Africa, the first wave reached its peak in the month of July last year, so that and at that time, then by August, we were starting to see the easing of the restrictions. During the hardcore lockdown, which we would call level 5 and level 4 in South Africa, the economy took a serious knock to the extent that we saw a lot of sectors literally coming to an end, to a standstill, to the extent that in the second quarter of the South African economy contracted and for the fourth consecutive quarter, plunging deeper into recession. GDP fell by just over 16% between the first and second quarters of 2020, and the economy shared about 2.2 million jobs during the same period. This is because most of the sectors of the economy were either operating at less than half their full capacity or had shut down completely. The tourism sector was not spared, actually was hard hit and came to a complete stop or halt. By July last year, 30% of our restaurants could no longer reopen, had actually literally gone out of business. The sector was facing a risk of losing close to 600,000 jobs. In short, the supply and demand market of the tourism sector had totally collapsed during the hardcore lockdown. As I already mentioned, we started easing the restrictions by August so that there was an impressive surge in economic activities. I'm not so sure what's happening, Program Director. It looks like.
Are you there? Minister, you're back. So that's perfect.
Okay.
We only lost you for a second.
Oh, okay. As mentioned earlier, We started easing the restrictions in August so that there was an impressive surge in economic activities. And this was seen in the third quarter. Manufacturing, trade, and mining were the biggest drivers of growth in that third quarter. One of the subsectors that performed subsectors in the tourism space. Spending on restaurants and hotels recorded a huge surge within the third quarter. However, we needed to understand that this impressive growth, very low base, that we had come to a complete stop. What was evident in terms of our economy was the road to recovery, and we were starting to see green shoots in most of the sectors of the economy. This was until mid-December, when scientists informed us that they picked up a new strain of the virus. The new strain was spreading so fast that soon realized that we were entering the second wave of the pandemic. Up until the advent of 501.V2 variant, we had not envisaged that the virus could mutate in a way that it could confound the effectiveness of vaccine that were already in the market. And we understand that major part of the recovery is based on, and still based on, the vaccine rollout. Now, that rendered AstraZeneca ineffective, but at least what is hopeful is that we're able to recover. Our scientists are also express concern that a third wave is possible, but I think many of us will be excited having heard the news today that if you've been able to, the second wave pandemic or the variant, it's actually assisting us to be immune. It creates immunity in terms of other variants. So it's quite good, and we're hoping that when we see the third wave, we'll be able to overcome and not see quite a huge impact in terms of our sector and our economy. But what is important for us to note is that in this all, it means that the sector is possibly facing numerous stop-start cycles as restrictions are increased or eased in line with the risk-adjusted approach. So you would not have one like we had anticipated, that we have one shutdown and then you open. Now we are seeing that as the risk goes high, we're closing. As the risk goes low, like we are now in level 1, then there's opening. And what it does, it brings some level of uncertainty in terms of recovery, and it calls for flexibility and adaptability in terms of the value chain of either of the sectors, especially within the tourism sector. One of the things that we must understand is that what it has done, it has impacted negatively in terms of the job market. We have seen the report that talks about the impact in terms of us seeing more increase of people being out of the work. Now, it is clear that all societal stakeholders, business, labor, civil society, and government, urgently need to work together to reverse the situation of difficulties in terms of our economy, in terms of the jobs that we are losing, and the people being at home. It is for this reason that the President, in his State of the Nation address last month, put an emphasis on the overriding priorities for 2021. The President implored all of us as South Africans to work together in achieving the following priorities. The first one is defeating the coronavirus pandemic. The second one is the accelerating economic recovery. The third one, implementing economic reforms to create sustainable jobs and drive inclusive economy. And then within the framework, with these priorities, will be the implementation of the economic reconstruction and recovery plan, which has the backing of all social partners, because we went to NETLEC to get the support of this. Now, when we look at tourism, you'd see that the tourism recovery has the pillars of the ERRP. So one of the pillars of the ERRP is tourism. And out of that, we have worked as the department to build on the tourism recovery plan that we are now concluding and going to cabinet. And in this plan of the tourism recovery, we are talking about the various areas that we are identifying. The travel and tourism has undergone some shifts, and this includes new consumer trends, which have to be taken into consideration when planning for the future. And this includes, for example, the demand for unique, sustainable, and inclusive dates and destinations, The demand open spaces or outdoor holidays to avoid congestion will increase. Road travel will increase compared to air travel. So if people come into South Africa would want to arrive through flights and perhaps drive, more likely for avoidance of busy destination will increase. The technology will have an impact, but also they would want to utilize technology in terms of either as they check in into their facilities, booking of attractions and all that. Remote working has become potentially holiday travelers. And that's why I encourage many of you, as we do this Zoom, you can do it in a destination, in a resort, in a holiday place. But what we need to understand is that the tourism recovery has been affected. The tourism recovery is based on 8 pillars, and what we say 8 strategic intervention. One is the implementation of norms and standards for safe operation of across the value chain to enable safe travel and rebuild traveler confidence. The second one will be to stimulate domestic demand through targeted initiatives and campaigns, as you'd see us going into provinces. Launch an investment and resource mobilization program to support supply requirement of the post-COVID-19 era. One of the elements is through what we are doing in the Tourism Equity Fund, mobilizing private sector resources to join and partner in PPP so that we can be able to protect the supply side. Support for the protection of core tourism infrastructure and assets. This we are doing in terms of our EPWP program, in terms of ensuring that the assets are kept. Execute a global marketing program to reignite international demand. Tourism regional integration so that we can offer more as a SADC region. Review the tourism policy as one of the most long-term issues. So we do believe that the overall economic recovery depends on our capacity and commitment to the implementation of our plan. And as we learn about the variant and what is happening, we are more confident that as we build on these pillars, we'll be able to see the recovery. But more importantly for us, as we talk about this and paying attention to what the state can do, what the social partners can do, is to remind South Africans that for us to win this battle, all of us have a responsibility. All of us have a role to play. We must continue to consistently and continuously wear our mask. We must continue to observe social distancing. We must continue to wash our hands with soap or sanitize our hands, because this battle can be won only if we work together. Everyone has a duty. Thank you very much.
Thank you very much, Minister. Appreciate your insights. Dr. Mahigo, thank you for joining us today. I know you're pressed for time, and we thank you for taking the time out to speak to us. I'm curious, tell us about the situation on the continent right now. Vaccine rollout is the biggest tool and ammunition we have in creating herd immunity and fighting the pandemic.
Thank you very much, Mrs. Eleni Giokos, our moderator this afternoon. And let me start by greeting our Honorable Minister, but also my fellow speakers, and also to all the journalists and communication experts that are joining us this afternoon for this important event. I'm really pleased to speak with you about the COVID-19 pandemic and the rollout of vaccine on the African continent, and to update on the variants that are currently circulating in the region. We have heard that from the Honorable Minister and how it created some issues. So we are now seeing emerging evidence from other parts of the world that indicates that the rollout of COVID-19 vaccines is really having a positive impact on reducing cases, hospitalization, and death. And so it is imperative that these vaccines are made available across the continent as soon as possible. I'm also very happy to that this week we really crossed a major milestone in the efforts to ensure an equitable distribution of COVID-19 vaccines. Ghana and Cote d'Ivoire became the first African countries to kick off vaccination using the Oxford AstraZeneca vaccine supplied through the COVAX facility. They joined 10 other African countries that have started to some extent their vaccination programs through either bilateral arrangement or donation. And as of this morning, 6 additional countries have received their first deliveries, and we expect shipment to arrive in all participating African countries this month. So this will be really a major achievement for the region. The COVAX facility, as you know, is a global initiative that is mainly co-led by WHO, Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovation, CEPI. And really, COVAX aims to ensure equitable access to COVID-19 vaccines everywhere. So the COVAX plans are to deliver around 600 million of vaccine doses to African countries by the end of this year, in order to cover at least 20% of the most at-risk and vulnerable people, including mainly the front healthcare workers, older people, but also other adults with comorbidities who are more likely to get severe disease and die from the disease. So to expand immunization beyond this first 20% that will be procured through COVAX, countries will need to procure additional vaccine doses through other sources, including mainly the African Union platform, but also other bilateral agreements. We are also encouraging wealthy countries, and I think this is quite very important, with the surplus doses of vaccine to make these vaccines available to African countries. Since November this year, last year, we have been working intensively with countries to be ready for the vaccine deliveries. I'm happy to say that 44 countries on the continent have developed detailed national deployment and vaccination plans that, of course, include identifying key challenges such as limitation of cold chain capacity management and handling, particularly for larger vaccine volumes. As country, we have seen starting to roll out immunization drives. WHO is providing operational support in key areas such as micro-planning, linking countries with the resources to expand cold chain capacity in the provinces and districts, monitoring and evaluation, and demand generation. So our country office teams are on the ground. They are working quite as the closest advisors to the Ministry of Health and collaborating really with partners to provide coordinated support. And we are starting to see preliminary evidence that suggests that vaccines may have varying level of efficacy against different variants. And so ongoing research will be important to better understand the extent of protection that the vaccine provide against different variants, and for population subgroup like older people. But even against the new variants, the COVID-19 vaccines show strong potential to prevent severe illness, hospitalization, and death. At WHO, we are really working with countries to track the emergence and particularly the circulation